Thank you, Dr. Meenakshi, the whole team, and AIOS for this opportunity. And it was really kind of enlightening to listen to all the talks since morning. And I will be talking about program accreditation. So we have been listening about the program methodologies, the tools that we have, the structures and the resources that we have. So at the end of the day, it boils down to how well we are using all of them together, and that's what an accreditation does. It validates whether we are doing the things what we should be doing the things correctly. So why accreditation? Because we know that unlike the ACGME criteria, where there is a minimum number and certain minimum criteria which is set for getting a certification, we don't have a minimum certification criteria in the country as of now. And there are several reports, published data, which tells us that the quality of the residents which pass out from the various institutes of the country can vary widely. Those who are coming from the premier institutes can be very well trained, whereas those which might not be coming from very premier institutes, the quality can be as low as people graduating without doing a single surgery. So that's where the role of accreditation comes into the picture. Now, why accreditation for us? Shroff has been doing training for a long time, for 25 years. We have trained several long-term, short-term trainees from across the world. Residency was something we started relatively recently in 2007 with just 4 seats. And we felt that we have been doing it, but we need to know whether we are doing it the way the world does it, whether we are at par with the global standards, and that's the reason we thought we need to have an accreditation, and that's the reason we applied for the accreditation from the Ophthalmology Foundation. So accreditation benefits not only the educators, the trainees, but also the institute as a whole, and in the process, everybody benefits. The other programs also tend to benefit. The quality of the training program improves. You are at par with the global standards, and at the end of the day, it's the patient care which improves, and that is what the role of any training program. We received our accreditation in June last year, and we had applied for the advanced level accreditation, and we received that, and I believe we are the first institute to receive the advanced level accreditation. So going through the whole process, I'll just take you through the steps of the process and what has been our experience, where we were, and what are the things which we already had, and what were the things which we had to put in place, the processes as well as the resources. And if anybody wants to replicate it, what should be the the steps. So there are 2 levels of accreditation based on certain parameters, the basic and the advanced standards, and there has been guidelines very clearly laid out by the OF for all of these standards. This is a 4-step cycle where we have a self-assessment questionnaire which has to be filled up. It's a pretty extensive questionnaire covering almost all the aspects of any training program. There is an external group review which happens on the self-assessment, followed by an accrediting organization review. And finally, once you receive the accreditation, you have to apply for a renewal every 5 years to maintain the accreditation. So these are some of the major parameters, and within each parameter, there are some minor sub-criteria which has been laid down. Broadly, these are the parameters which covers the structure, process, as well as the outcome of any training program. A self-assessment which has to be filled up by the organization, followed by a site visit, which can be virtual or a physical from the accrediting body, is how the process goes. So I'll briefly go through some of these parameters and what we did and what we had and how easy or difficult it was for us. So educational program, the most important part is the curriculum, which has to be standardized with standard contents covering both the theory and the practical aspects. Evidence-based and scientific methods are a very important parameter. Subspecialty training has to be incorporated in the curriculum, and there has to be an administrative structure and an organogram who is going to oversee the whole training program. It's also important to balance training and service, and fortunately we had already ongoing fellowship training program. Initially we were skeptical whether this is going to be a conflict with the residency program, but we realized that this was actually a benefit, because having the curriculums for our subspecialty training, which were at par with the ICO curriculum with little modification to meet our requirements, it actually helped us in putting up the curriculum for the residency program also. And since we have an extensive subspecialty, we are in subspecialty based hospital with almost 50 subspecialists, specialists across all the subspecialty, doing more than 20,000 subspecialty surgery every year in the Delhi branch. It was pretty easy for us to give almost exposure to all the subspecialty for the residents. Biostats class module was already ongoing for us. We have been doing it for the last 10 years. Every 6 months we have a module which has been taken by some of the internal as well as external faculty. We have weekly journal clubs where all the kind of, the standard evidence-based protocol is followed whenever a trainee is presenting the journal article. So this part was the one which was a little bit challenging, balancing training and service, because as part of the requirement, the residents also need to get some exposure of the outreach and the community programs. And we have our residents who rotate in the various outreach clinics and the satellite centers of the hospital, some of which can be in the very rural areas. But fortunately, again, since we have full-time specialists in all our secondary level hospital also, while they were serving in the community setting, they also had continuity of their training. Resources, we had a lot of talks on the wet lab. I think that is the crutch of any training program. We need to have a very good wet lab because most of the things can be covered, at least the surgical training part in the wet lab. Again, we have a well-equipped wet lab with 5 microscopes and tables. We have a simulator also, and we have been doing a lot of surgeries in the wet labs. In fact, I was just looking through the procedures. We almost offer 42 procedures across all the subspecialties on the wet lab, on the various tools using GoatSci, VR simulator. We have the Orbis simulator, the VaxSci, and many other models like the pig head for the oculoplasty surgeries. So it was pretty easy for to give those exposure to the residents also. The teaching tools, we have already spoken about it. Other resources like a well-equipped library with access to the journal articles, reading room facility, classroom with digital connectivity, so that even the residents, they're posted in the outreach clinic, they can get connected to the classes, the grand rounds, which happens twice a week via the Zoom. Research and academics has been another very important aspect, and we encourage all our trainees, our residents, to participate in the various forums and the conferences. And I was just looking at the last year data. We had our trainees at 42 presentations in the various nationals and international forum with 31 publications and 4 awards. So it's a culture which boils down even to the residents if it is already existing in any organization in other training programs. Another important highlight, which is important and is an important aspect of an advanced level accreditation, is giving exposure to the residents to global ophthalmology. So as part of global ophthalmology curriculum, we have a residency rotation program where every year our residents, one of the residents based on the performance, get to spend a month in the University of Wisconsin, and their residents come to us for 2 weeks every year. So it's an exchange program which gives the resident exposure to what's happening to the rest of the part of the world also. Assessment system, we have again looked at all the tools, the OSCAR, OSEX, the soft skill review, surgical complications. What we have done for us, we know we have all the tools, but what we found initially difficult was the tools like the OSCAR, if it's on a hard copy, sometimes it tends to get missed. Either the resident or the faculty did not have enough time, or they were doing it little later on where you don't remember what happened during the time of surgery. So we put up the whole OSCAR and made an app. It's on the Android, it's freely downloadable, and all the trainee, whenever they join, they mandatorily have to download the app. They get their own login ID. There is a trainer ID and a trainee login ID. And every surgery, before they start the surgery, they have to enter in the app. And once they choose the trainer, it will automatically show in the trainer dashboard. That way, the trainer who is standing there is a tab which is kept in the training OT and can do a real-time scoring of the OSCAR. And that has really improved the scoring process. And another important part, if suppose there is another trainer on the subsequent day who might not know how well the trainee is doing, there is a progress report of the last 10 surgeries which the trainer can see, so that if there is any specific comments given, those will also become visible in the app. So this has really helped in sort of keeping a track of the training. We do maintain a logbook. Fortunately, DNB has a very good structured curriculum. We have just adopted that, put it in the form of a booklet, which is given to all residents, which covers the subspecialty posting with very specific things written down, what they have to do clinically, what they have to do surgically, what is going to be the didactic curriculum. Everything is given at the beginning of the posting. We have a monthly logbook review of their cataract as well as their subspecialty logbook, and the trainers, everybody, it's a common class, it's a learning for everyone. So everybody will be sitting there, all the faculty, to know what has been the progress. And when we are filling up the accreditation self form, it was very easy for us because we already had those numbers as part of the logbook of all the trainees. Selection, numbers, counseling, these are all again part of the process because they come through the NEET counseling. The stipend and all are predetermined, so we did not have too much of say in that. And the other important aspect is the learners wellness program. We try to incorporate those aspects also by having other sessions other than the clinics, sessions on mindfulness. We have an inspired series of lectures where we call the faculty from various aspects of the not only ophthalmology but other aspects to talk about their life experiences and service and other aspects, so that this becomes a motivation and for the trainees also. Trainers, I think that is a very, very important aspect. The trainer need to have dedicated time. They need to have ongoing train-the-trainer programs. They also need an evaluation recognition program. And what we have done is we have a dedicated training OR where the faculty that day do not have any other things to do except for doing the training. And that way they can focus much more on just the training rather than bothering about their own list. Train the Trainer program is an ongoing thing which again keeps on happening. We have several modules which are developed internally, which are taken by the internal faculty, but we do have external faculty. Dr. Gornik has come over several times for doing the Train the Trainer programs, and this is something which we keep on doing for our own trainers. So what we added and modified while going through the accreditation process is the program evaluation, which was not very structured earlier, and taking a 360-degree feedback, which was again, I would say, was not available. So we started taking feedback about the rotation and the experience of each trainee in the various areas, in the various departments, and it was an annual feedback process which was implemented, and that feedback report was then formally shared with each area head, each head of the department, so that they get to know how they scored and what is their score in comparison with the other department. So that becomes an objective way of assessing how good or how not so good they are doing and what are the areas which needs probably corrections. The same feedback is taken for each individual faculty also, both for surgical training in the form of a faculty coaching feedback form, and also as an annual feedback from the residents. This feedback is again shared with each individual faculty, and recently based on the feedback which you received, we started, in fact this year itself, last week was our convocation, and this was the first time we started giving the Training Excellence Award to the trainers also as part of their contribution and recognition to the training, because this is something which is extremely important to keep the trainers motivated to do what they are doing. So just to conclude, the key takeaways are that it was a self-improvement process. It was a self-check and a validation that what we are doing is the right thing, and what are the areas where we needed improvement, and we did a lot of improvement post this accreditation. We got a global spotlight because of that. The quality of our learners has improved. The people who are seeking us has improved. And if I see the data, when we had the first DNB resident who joined us, who had a rank of about 17,000 all India, and this year the resident who took up Shroff as residency had a rank of about 1,200. So that speaks a lot about the people who are seeking you. So, and I would say it's very important to have a checklist to ensure that you are ready for accreditation, and the guidelines gives a very comprehensive checklist. We don't have to do much, just go through them. We just have to implement those, put up the processes, and incorporate the resources. Thank you very much for your attention.
Thank you, Dr. Sima, and congratulations for the accreditation. And I think you have highlighted some very important points, especially the digitalization of the wet lab. So this Orbis International and many of the INGOs are coming for the digitalization on wet lab. I think you're the first one to start in India. We are also going to start this way. So this will really help in the residents' learning and the mentors' training.
Absolutely.
So everything, once it is digitalized, we know actually how much is the quality time that has been spent in training and also in learning. So congratulations.